Nurse Choma, your NCLEX Prep Coach. I am the founder of Choosing Nursing over at choosingnursing.net, where we help you to pass your NCLEX exam. If this is your first time watching me, I appreciate you watching. I am pretty much somebody who helps to equip, teach you, and train you how to pass your NCLEX exam. So if you are either in nursing school or you're a nursing graduate, you took in your exam a couple of times or more, I hope that these videos will encourage you and help you to believe that it really is possible to be successful and pass your test and go on to enjoy your nursing career. So a little bit about myself. I graduated from May 2010 with my BSN degree from San Diego State University. So that's literally 8 years ago from now. So I've been practicing it as a nurse. I practiced med-surg tele for 4 years, and then about a year in insurance nursing, and then helping people to pass their test now 3 years. So this month would actually make it 3 official years helping me to pass the test. So we've been very successful with helping many nurse graduates all over the country, all over the world. You can find some of our testimonials over on the website at choosingnursing.net. Also, if this is your first time watching, then go ahead and follow me. I promise you that I give you great information. You can also follow me as well over on Instagram. It's going to be choosing_nursing on Instagram. And then you can also follow me over on YouTube over at Choosing Nursing. What we do on YouTube, we put weekly videos on there. And then finally, but certainly not least, you can also follow me over on Pinterest as well. So on Pinterest, it's also Choosing Nursing. So we're going to be covering renal disorders on the NCLEX exam. Renal disorders. So hopefully this is going to give you some understanding, some clarity when it comes to the urinary system on the test. So what I'm going to do, I'm going to go over, obviously I'm not going to go over every single renal disorder, but I'm going to go over some really important ones that you should definitely know for the test, right? You should definitely know what these disorders are, get comfortable with them. You know, one thing I try to do by mentioning the specific disease processes, one thing I would encourage you to do is to go back and, you know, review what I just went over with you. So that way it, you know, really hits home, and, you know, so that way it really hits home with you, and that you're aware of what's the most significant thing to know for the test. So let's start off with UTI infections. That's the first thing we're going to cover. And one thing that will help you when you're learning these type of disorders or these problems is to first get an understanding, right, of the renal system itself, right? That's something I always tell people. You got to know the processes before you understand the diseases, right? So seeing like a visual, looking at the kidneys, you know, that would make sense with the GFR rate, right? Looking at the ureters, look at the bladder, how everything flows together, it will make more sense when you're learning all these problems. So let's begin, like I said, with UTI infections, okay? So did you know when it comes to the UTI infections, you have upper UTI infections as far as we're looking at the renal system? You have upper UTI infections, and then you have lower UTI infections. So the upper is pretty much referring to the kidneys, and then the lower is referring more to the ureters as well as the bladder. So an upper UTI would look like would be pyelonephritis. That would be an example of upper UTI infection. In fact, you know, before I break down between the two, let me first talk about UTIs in general. So one of the things as well is that one thing you got to know for the test and clinically is that when elderly patients have a UTI, they show a difference in symptoms. So when an elderly patient has a UTI infection, they'll become confused. All right, that's one of the hallmark signs of UTI infections with elderly patients versus, you know, the normal response for like a healthy adult to have UTI infections to complain of like burning and, you know, having to go to the bathroom a lot. But with older adults though, they're going to show signs of confusion, especially, in long-term care facilities or nursing home facilities, because there's more bacteria that's being exposed, and it's more likely to occur. As far as to the number one source of bacteria when it comes to UTI infections is E. coli. All right, E. coli. So the thing about it, you gotta know, right? You have to know specific bacterias when it comes to disease processes, right? Because the exam can test you like that too, where it will say, okay, the patient has pneumonia, or the patient has, this disease process. Which bacteria is this likely from, right? So you gotta be comfortable also as well with the type of bacteria. All right, that's a mental note. Write that down. Okay, let's go into it now as far as like the upper and the lower UTI infection. So upper UTI infection, with the upper UTI infection, you're gonna see pyelonephritis. With pyelonephritis, this can happen, men, women, younger adults. Like, it's not something that's more prone to like elderly when it comes to pyelonephritis. And pyelonephritis, like the type of problems that they're gonna have, they're gonna come in, and it's just like a hallmark symptoms with pyelonephritis that really separates pyelo versus others' problems. They come in complaining of really bad nausea and vomiting. So literally, while they're in front of you, they're throwing up. They're throwing up, and they're very, very nauseous. So they're not able to eat anything. They have very severe pain. So usually like abdominal pain, back pain, flank pain, pain near their kidney areas. So like I said, you're going to see them. They're going to complain about really bad pain. They're going to be nauseated, vomiting, and also they tend to have a fever as well. Okay, so they're going to have a fever. They're going to, like I said, have really bad back pain. They're going to also be nauseated and vomiting. All of these, right, that I'm sharing with you right now are the signs and symptoms that you want to be aware of when it comes to the exam, right? These are the specific hallmark symptoms for pyelonephritis. All right, so and then also, of course, pain with urination. That's usually the hallmark symptom with all the UTI infections, is that they're going to complain of burning, pain when they're urinating. But the hallmark symptoms that separates pyelonephritis is that fever, severe pain, and then they're nauseated, they're throwing up. That's not like the other ones. This one is let me tell you, it's very painful. It's very, very painful. Like I remember having, I don't forget, there's some patients, no matter how long ago it's been, that I just don't forget. And I remember having this one lady who had pyelonephritis, and she was in so much pain. And we were literally giving her, her diagnosis was pyelonephritis, and we were giving her, like Dilaudid and everything around the clock just to try and make her pain tolerable. So, so that's pyelonephritis. Now, one thing I'm going to share with you too, pyelonephritis is an upper GI infection. Then you have the lower ones, which is going to look like cystitis, which is infection of the bladder, and then also urethritis, which is infection of the urethra. So all of these UTI infections, though, they have the same treatment. Write that down, okay? They all have the same treatment. So what I'm sharing with you right now, first I'm going over the upper versus lower, the signs and symptoms that separate them, and then I'll give you the treatment, which pretty much is how you treat all of them, because like I said, they're all UTI infections, right? So the next one is going to be cystitis. This is going to involve, this is pretty much where the bladder is inflamed now. All right, they're having like inflammation of the bladder. So this is the urinary system. Okay, the urinary system pretty much looks like you have the kidneys, right? So pretend like my hands. Pretend like my hands are two kidneys, right? So you have the kidneys, and then it connects to the bladder, right? And then the bladder runs down the urethra, which comes out of, whether it's a man, the penis, and then if it's a woman, the vagina. So cystitis is inflammation of the bladder. All right, that's cystitis, and this is, like I said, lower GI infection. So here are the signs and symptoms with cystitis. So you're going to see frequency, urgency, and dysuria. One more time. Frequency, urgency, and dysuria. So they keep going a lot, right? Like they have to keep going, but they're not really, like they're having like a weak stream though. Like it's hard for them to still urinate, but they keep having to keep going to the bathroom. So frequency, they're having also urgency, like when they have to go, they have to really go very quickly. This is what you call the triad symptoms for cystitis. This is the hallmark symptom. So remember how I just said right now, the hallmark for pyelonephritis? So the hallmark with cystitis is frequency, urgency, and then dysuria. And then also you'll see them as well. They can have nocturia, which is where they, have to get up a lot at night to pee. They can also have, like I said, like a weaker stream. And then also another thing as well, they will be, sometimes they'll be incontinent, right, as well. And that could probably be more common with elderly adults, but those are also some of the symptoms that you can see. So they can have like a cloudy urine. They will have hematuria. This is one of the significant things that you'll see with bladder infection versus like the kidneys being inflamed or the ureters being inflamed. They will have like bloody urine. I remember this so well. Like once you see, let me tell you, when you see bloody urine, you don't forget it. Like you really don't, because it's such a distinct color. It's just so bright, like literally bright red. Like just imagine bright red urine, and also sometimes I have, like some patients I've seen like clots in the urine too. So they can have hematuria, as well as also like a cloudy urine as well. All of these are symptoms that you see with cystitis. And then also they can also complain of having lower back pain too, right? So lower, because remember it's the bladder that it's also targeting too. So they can also complain of lower back pain as well.